Welcome back, folks. There's no doubt that our pets, we tell you this all the time, add a ton of fun and happiness to our lives, and that means we have to do our best to keep them healthy and active. And when they need special care, affiliated veterinary specialists have a team ready to help. Dr. Sharon Tenenbaum is an anesthesiology specialist with AVS. She's joining us today, and good to see you.
Good morning.
Thanks for being here.
Thank you for having me.
Matt and I were playing with these very important instruments that you use for your job, and we'll get into explaining what they do, because I think we were using them incorrectly.
I think
so. But for those who don't know about AVS, and that's somebody new to the show because we talk to you every week, how long has AVS been in North Florida?
We've been around for around 20 years now, and we serve in 4 different locations. So in Jacksonville, Orange Park, and we also have locations in Gainesville and Daytona.
And for those, it says it in the name, affiliated veterinary specialist. So we try to tell people that don't just, after this segment, don't bring your dog down to get rabies shots.
No, so we are actually a group of veterinary specialists. All of us specialize in different areas of veterinary medicine, and we work with your regular veterinarian to provide services that they may not offer at their hospital.
And so let's get into your role. We're talking about some of the instruments you use. You're probably gonna have to sterilize these before you use them again. But what is your role at AVS?
So I'm an anesthesiologist specialist. So what anesthesia is a controlled unconsciousness, just like we do in human medicine, and we deliver drugs to make the patient unable to move or feel pain during a procedure.
So let's go through kind of how it works. I mean, a patient, or well, the patient's the animal, but somebody comes in, drops their animal off. You guys take them back there. What is the process?
So the initial step is to perform a pre-anesthetic exam. We usually listen to their heart and lungs, make sure everything sounds normal. We may run additional blood work just to make sure there's no contraindication to doing anesthesia. Once the patient's gone through all that, we usually pre-medicate them. So we usually use a sedative or an anxiolytic drug or a pain drug as well to get them a little bit more sedate. Then we usually place an IV catheter, just like in humans, where we administer drugs that cause unconsciousness.
That's not any of these?
That's not any of these. Once they are unconscious, we're able to then establish an airway, and we use what you guys were using before. This is a light source. It's a laryngeoscope. You can use it to visualize the airway and to intubate. I brought different size tubes as well, something as small as something you would use for a little cat, also a medium-sized dog. And then this is probably more like a Mastiff or a Great Dane. And this is what we place in the airway so we can control their level of anesthesia, deliver gas anesthetics to keep them unconscious, and
that goes
be
down
able to monitor their respiration and ventilation.
That gets down into the
trachea? Yeah, the airway.
Whoa, and that delivers it there.
And that's about the size of a human tube. But you can see that a dog requires, the big dogs require a little bit of a bigger tube.
Yeah, there's no chance. There's no chance of getting it. That's the one thing I always kind of amazed at is anesthesia is a hard enough practice in medicine to learn, but to do it with animals, like humans, you can administer that pre-surgery one, and you kind of see there, you hear them talking, they tell you to count to 10, and by the time you get to 3, you're out.
Yeah.
But animals.
It's exactly the
same. How do you know?
And it's almost identical drugs that we use as well to induce unconsciousness and to maintain anesthesia.
But how do you know based on, it's not just weight, right?
It is based on their weight and their medical history. So the drugs that are chosen, every patient that comes to AVS will get a specific protocol made for them based on their size and their medical history.
And then during surgery, just like a human, you're monitoring?
Yeah, so once after they're induced, they get hooked up to a specialized monitor. We monitor things like ECG, so electrical activity of the heart. We also measure their saturation, which is this little piece of equipment that you were using earlier. So it tells you the oxygenation that's being delivered to the tissues, the thing you put on your ear earlier. Yeah. We also measure their ventilation and respiration, their temperature, because a lot of them tend to get cold under anesthesia. And that's a continuous monitoring throughout the whole procedure, so your pet is never not looked at.
I tell you what, I learned a long time ago that inside a surgery room, and I think this might be the same for pets or for animals as well, the anesthesiologist is like the most important person in the room. They call the shots. Yes. If they want to end the surgery, they can end the surgery if they want.
Yeah, absolutely. If something is not going well, we heavily communicate with the surgeons to make sure that they know that we do not recommend to continue with the procedure.
That's amazing. So, you're the boss. I mean,
I guess you can say that.
You're holding that. It's just such an amazing science, and I'm sure there's tons more school than I would possibly be able to handle to do it. But
Yeah.
I'm glad people like you are
Thank you.
there. Yeah, that's amazing. AVS, we want to thank them for making this segment possible. And for more information, you can visit avspethospitals.com. You can call the Jacksonville office at 904-646-1287. It's on your screen right there. Or you can also call the Orange Park office at 904-278-0287. Again, right there on your screen.